Part 1: The Secret of Vitamin D. The invisible man who determines your health. I want to share with you a truth that you may have never thought of. Just by looking at a single number in your blood test results, without knowing anything else, I can predict a part of your overall health. Yes, just one index, and that index is vitamin D. You think vitamin D is only related to strong bones, preventing osteoporosis, right? If you think so, then I'm sorry, but you're missing out on one of the biggest medical secrets of this century. Why? Because a lack of vitamin D doesn't just weaken your bones. It can also promote inflammation, increase your risk of cancer, impair your memory, disrupt your immune system, and even make your brain degenerate faster. I know, it sounds unbelievable, but you'll understand soon enough. And I promise, when you hear the whole story, you will see vitamin D in a completely different light. Origin story: soft bone disease and historical discovery. Going back more than 100 years ago, around 1920, doctors in Europe discovered a strange phenomenon. Many children living in industrial cities, lacking sunlight, had crooked, weak, and people called the disease rickets. These children could not develop strong bones, despite eating well. Their bones were soft like rubber, medically called osteomalacia, soft bones. Scientists at that time began to search for the cause, and they discovered an important factor, a special vitamin produced when the skin is exposed to sunlight. That is vitamin D. When children are supplemented with this vitamin, miraculously, rickets disappears, the bones become stronger, the body develops normally. Since then, vitamin D has been considered the key to bringing calcium into the bones, and for decades, people have known almost only one role of vitamin D: building and maintaining the skeletal system. But that is only the first chapter. There are many secrets hidden for decades after that. The classic role of vitamin D and the old thinking trap. Vitamin D is often called the bone vitamin. Why? Because it helps the body absorb calcium and phosphorus from food, transport them to the bones, making the bones strong. Without vitamin D, the calcium you take can go straight out through the urine with little effect. So, in classical medicine, when people say vitamin D supplementation, they simply think, it sounds reasonable, but there is a big problem. Vitamin D is not just a bone vitamin. It also participates in hundreds, even thousands of other vital processes. But many doctors, many health organizations, are still stuck in that old view. You see, if we only care about whether the bones are strong or not, people might think, well, below 20 nanograms ml is deficient, but above that is enough. But the truth is much more complicated, revealing the non-traditional role, the hidden part of the iceberg. Now imagine this. Vitamin D is like a central power switch. You turn it on, a series of systems in the body work smoothly. You turn it off, the whole body starts to malfunction. In addition to attaching calcium to bones, vitamin D also, immunoregulation, helps the immune system function properly, strong enough to fight bacteria, viruses, but not overdone, causing autoimmune diseases. Control inflammation. When lacking vitamin D, the inflammatory response in the body flares up, smoldering like a small, persistent fire. Participate in the process of cell death. Apoptosis helps remove damaged cells, preventing cancer. Neurological support. Vitamin D stimulates neurogenesis, the formation of new neurons, creating new connections in the brain. This is extremely important for learning, memory, and recovery from brain damage. Does it sound familiar? Diseases such as Alzheimer's, Parkinson's, depression, autism are all related to the decline of neural connections. And vitamin D, which many people think of as just for strong bones, plays an important role in the brain. The tricky question: cause or effect? This is where I want you to think. If someone has cancer, diabetes, depression, and then a blood test shows low vitamin D, which comes first? Does vitamin D deficiency cause illness? Or is it because of illness that the body can no longer use vitamin D effectively? The truth is, both are true. Vitamin D deficiency can open the door for disease to strike, and once disease has set in, it becomes increasingly difficult for the body to maintain stable vitamin D levels. A silent global pandemic. So, how severe is the global vitamin D deficiency? You may be shocked to hear this number. Between 42% and 97% of the world's population is deficient in vitamin D, depending on the country and region. In some places where vitamin D is added to foods such as milk, cereals, the deficiency rate can be only around 40%. But in the Middle East, where many people have little sun exposure, this number can be as high as 97%. That is, almost the entire population. See, this is not personal, it is a silent epidemic, but it is rarely noticed. Enough levels, and the trap of numbers. The traditional norm is below 20 ng per milliliter, deficient, 20–30 ng ml, mildly deficient, above 30 ng per milliliter, fine. What about other important functions? Immune, neurological, anti-cancer. Is 30 ng per milliliter enough? Most modern nutritionists and functional medicine practitioners agree. The optimal level should be between 50 to 80 ng ml. Part 2. Vitamin D, the silent balancer in the body. We have discovered that vitamin D is not just a bone vitamin. It is like a central switch, controlling everything from the immune system, the nervous system to genetic stability. But a big question still hangs. Why in the modern age, when medicine is developed, food is abundant, and supplements are abundant, are we witnessing a vitamin D deficiency epidemic? Let me go deeper, and you will see, the cause is not simple. The harsh truth, sunlight is no longer a savior. You have probably heard, just go out in the sun and you will have enough vitamin D. Yes, but that was a story hundreds of years ago. Things have changed today. Air pollution. Dense layers of fine dust block UVB rays, the rays that help the skin synthesize vitamin D. That means you can stand outside for hours and still not produce much. Modern lifestyle, clothing and culture. Very few people sunbathe topless like their ancestors. Clothing covers a large area of skin, significantly limiting the ability to synthesize vitamin D. Skin color and pigmentation. People with darker skin need more time to synthesize vitamin D than people with lighter skin. This is why the rate of vitamin D deficiency in communities of color is often higher. Age. As we age, our skin loses its ability to produce vitamin D. Even if the elderly go out in the sun, the effect is still very poor. Results. Sunlight is no longer a safe ticket for vitamin D as many people think. The gloomy picture. Diseases related to vitamin D deficiency. So, what happens when there is a lack of vitamin D? Let me check out the diseases that silently knock on the body's door. 1. Cancer. When cells rebel. Remember, vitamin D controls so the vision and program cell death. Without it, cells begin to divide indiscriminately, lose the ability to differentiate, and DNA is easily damaged. Those are the 3 factors that create malignant cancer. Studies have shown people with low vitamin D levels have a higher risk of breast, prostate, and colorectal cancer. Vitamin D supplementation, unless 1,000 U per day, can reduce the risk of these cancers by 60 to 77%. 2. Autoimmune disease. When the body turns its back. The immune system is designed to recognize and destroy external enemies, bacteria, viruses, parasites. But when there is a lack of vitamin D, this system becomes unbalanced. It cannot distinguish between friend and foe. The result? It begins to attack its own body. That is the mechanism of a series of autoimmune diseases. Lupus erythematosus attacks many organs. Psoriasis, psoriatic arthritis. Type 1 diabetes attacks the pancreas. Scary, right? Just because of a lack of vitamin D, the body can turn into its own most dangerous enemy. 3. Neurodegeneration. When the brain slows down. Have you ever worried about Alzheimer's, Parkinson's, dementia? Know that vitamin D, the silent guardian of the brain, it promotes the creation of new neurons. It protects the substantia nigra, the place where dopamine is produced, extremely important for movement. It supports brain recovery after injury. When vitamin D is deficient, dopamine decreases, gives the risk of Parkinson's increases. The nervous system is easily inflamed, gives memory loss. Alzheimer's is approaching. 4. Mental disorders, the darkness of the mind. You may not expect it, but vitamin D also affects mood and emotions. Many studies have found vitamin D deficiency is also associated with an increased risk of schizophrenia. This explains why in winter, when there is less sunlight, many people fall into a state of depression, the syndrome of seasonal depression. Factors that hinder vitamin D in the body. Let's say you have taken vitamin D supplements. Is that enough? Sorry, but not necessarily, because vitamin D has to go through a complex journey: absorption, transportation, binding, and activation. Just one link is faulty, the whole effect will be ruined. 1. Poor absorption. Vitamin D is a fat-soluble vitamin. If you eat too little fat, or have liver and gallbladder disease, reduced bile secretion, the ability to absorb will be greatly reduced. In fact, one study showed that taking vitamin D with a high-fat meal can increase absorption by up to 50% compared to taking it on an empty stomach. 2. Transport problems. After absorption, vitamin D needs a carrier, the vitamin D binding protein VDBP. If this protein is lacking, vitamin D will float aimlessly and not be effective. VDBP deficiency has been shown to be associated with breast cancer, prostate cancer, and colon cancer. 3. Weakened vitamin D receptors. Vitamin D cannot enter cells if the vitamin D receptor VDR is damaged. This receptor is present in most organs, but is especially important in kidneys. Immune cells. Factors that hinder vitamin D in the body. Let's say you have taken vitamin D supplements. Is that enough? Sorry, but not necessarily, because vitamin D has to go through a complex journey: absorption, transportation, binding, and activation. Just one link is faulty, the whole effect will be ruined. 1. Poor absorption. Vitamin D is a fat-soluble vitamin. If you eat too little fat, or have liver and gallbladder disease, reduced bile secretion, the ability to absorb will be greatly reduced. In fact, one study showed that taking vitamin D with a high-fat meal can increase absorption by up to 50% compared to taking it on an empty stomach. 2. Transport problems. After absorption, vitamin D needs a carrier, the vitamin D binding protein VDBP. If this protein is lacking, vitamin D will float aimlessly and not be effective. VDBP deficiency has been shown to be associated with breast cancer, prostate cancer, and colon cancer. 3. Weakened vitamin D receptors. Vitamin D cannot enter cells if the vitamin D receptor VDR is damaged. This receptor is present in most organs, but is especially important in kidneys. Immune cell. Hypothalamus, substantia nigra. If the receptor is not working well, no matter how much vitamin D you take, it won't help much. 4. Synergy with other nutrients. Vitamin D is like a captain, but to win, the captain needs teammates. These teammates include magnesium. Megagram participates in hundreds of biochemical reactions, is the most important coagonist of vitamin D. Omega-3 EPA, DHA, supports transport and activation. Zinc Zn, essential for the immune system and receptors. Boron, a little known but extremely important mineral. Vitamin K2, helps coordinate calcium to the right place into the bones, instead of getting lost in the blood vessels. Without them, vitamin D would be like a good general but cut off. Ideal levels, a double-edged sword. You may be wondering, so, what is the optimal blood vitamin D level? Here is the answer. Below 20 ng per milliliter gives severe deficiency. 20 to 30 ng ml gives mild deficiency, not enough for full function. 30 to 50 ng/ml gives okay, but not ideal. 50 to 80 ng/ml gives optimal range. The body benefits the most. Above 100 ng per milliliter gives risk of poisoning. Increased blood calcium can damage the kidneys and blood vessels. So, vitamin D is like a double-edged sword. Too little gives surrounded by diseases. Too much gives toxicity. That's why I always emphasize, blood tests must be done, measurements must be taken, and supplements cannot be added blindly. The mysterious journey of vitamin D, and how to optimize it for yourself. Imagine you've just swallowed a vitamin D pill. It's small, round, maybe only a few hundred international units EU. Do you think it will work immediately? Wrong. That pill is just a seed. To become a big tree that protects your health, it has to go through an extremely arduous journey, with countless stops, checks, and chemical changes. Let's follow the footsteps of that vitamin D seed. Step 1. Absorption in the small intestine. Vitamin D is fat-soluble. That means it needs to be accompanied by fat to be absorbed. If you take vitamin D on an empty stomach, or with black coffee, most of it will pass like a stranger, leaving no trace. But if you drink it with a meal containing a little olive oil, avocado, or fatty fish, vitamin D will be dissolved in micelles, tiny fat droplets, thereby passing through the intestinal wall into the blood. The problem is, many modern people are on a low-fat diet, afraid of fat. The consequence, they take vitamin D for years, but the absorption efficiency is not much. Step 2. Transport in the blood. Vitamin D is now present in the bloodstream, but it cannot swim on its own. It needs a specialized vehicle, vitamin D binding protein VDBP. If your body lacks this protein, vitamin D will sink in the bloodstream, not reaching the organs that need it. An example, breast cancer patients have much lower VDBP levels than healthy people. That is, not only do they lack vitamin D, but even if they do have it, they cannot transport it effectively. Step 3. First activation in the liver. The original vitamin D from sunlight or food is not yet active. It's like a new student entering school. In the liver, a special enzyme will add a hydroxyl group, O, to the vitamin D molecule, turning it into 25-hydroxyvitamin D, 25-OD. This is the form measured in a blood test. But remember, 25-OD is still just a reserve form, not really powerful. Step 4. Second activation in the kidney. The journey doesn't stop there. From the liver, vitamin D must go to the kidney, where a second transformation takes place. Here, the 1-alpha-hydroxylase enzyme will continue to attach another hydroxyl group, forming 125-dihydroxyvitamin D, 125O to D, also known as calcitriol. This is the truly biologically active form, the commander. Calcitriol can enter most cells, attach to the VDR receptor, turn on the gene switch, and control a series of functions. Step 5. Enter the cell and turn on the gene. Did you know that the human body has about 20,000 genes, of which vitamin D can directly affect more than 2,000 genes? That is 1/10 of the entire genome. When calcitriol attaches to the VDR receptor, it forms a magical complex, enters the cell nucleus, and attaches to the DNA. From there, it can turn on the gene that produces protective proteins, or turn off genes that cause inflammation and cancer. Think of it like a DJ adjusting thousands of switches in your genetic symphony. When the journey is interrupted, but, sadly, the journey can be interrupted at any stage. Poor intestinal absorption, lack of fat, digestive disease, low VDBP, poor transport, liver disease, hepatitis, cirrhosis gives not making enough 25-OD. Kidney failure, chronic kidney disease gives not making enough calcitriol. VDR receptor mutation gives vitamin D cannot enter the cell. When one link is broken, the whole system breaks down. And you know what? The consequences are chain diseases. Vitamin D supplementation. More art than science. So, how should we supplement vitamin D properly? Remember, it's not as simple as more is better. It's a balancing act. 1. Dosage. The official recommended intake RDA is usually adults 600-800 IU a day, older adults 800 to 1000 U per day. But in reality, this is only enough to prevent rickets. To reach the optimal blood level of 50 to 80 Ng in ml, most people need 2000 to 5000 U per day. Some special patients' cancer, autoimmune may need up to 10,000 U per day, but must be closely monitored by a doctor. 2. When to take? Best, with a fatty meal lunch or dinner. Not recommended? On an empty stomach, or with plain water. 3. Necessary synergy. As I have emphasized, vitamin D cannot go it alone. You need to combine it with magnesium megagram. Without Mg, vitamin D will not be metabolized properly. Vitamin K2 directs calcium into the bones instead of into the blood vessels. Omega-3 enhances transport and reduces inflammation. Zinc and boron support receptors and activation. 4. Regular testing. No one is the same. Some people need 2000 U per day. Others need 5000 EU. Only blood tests can give you the exact answer. At least every 6 months, you should check your 25OD to know where you are. Vitamin D, the mirror of precision medicine. From this journey, we learned a big lesson. Nothing is as simple as just drink a lot and you will be healthy. Vitamin D, the clear demonstration of personalized medicine. It forces us to see the body as a complex system, in need of synchronization, coordination, and measurement. Real-life situation, patient in clinic. To help you visualize better, let me tell you a real case. Personal information has been changed. A patient 42-year-old woman presented with fatigue, hair loss, and mild joint pain. She had been taking vitamin D 1000 U per day for a year. Test. Her 25OD level was only 18 Ng ml, still in the deficient range. Severe magnesium deficiency. After adjustment, take vitamin D 5000 U with dinner containing olive oil. Supplement magnesium. Add K2. 3 months later, 25OD level was up to 55 Ng ml. Symptoms improved significantly. The lesson here, it is not just the dosage, but the way of use, the context, and the synergy that determine success. The big takeaway, vitamin D is the golden key. Vitamin D is more than just a bone vitamin. It's a systemic hormone that regulates immunity, genetics, nerves, and psychology. It's the golden key to keeping cells dividing properly, preventing cancer, keeping the immune system neutral, not attacking itself, protecting the brain and mind from degeneration, and its journey through the body, from sunlight, to the gut, to the liver, to the kidneys, to the DNA, is a marvelous testament to the ingenuity of human biology. The final message, you may be listening to me and wondering, so, what do I need to do tomorrow? The answer is simple. Check your vitamin D levels. If you're deficient, supplement strategically, the right dose, the right way, with the right synergy. Don't underestimate it. Don't be subjective, because what you think is small can decide your whole life. Remember, in medicine, sometimes the difference between illness and health lies in a small molecule, like vitamin D.